Have you ever been told your ferritin levels are too high or too low, but you had no idea what that meant? Maybe you've seen the word on your blood test results and thought, is this serious? Should I be worried? Well, you're in the right place. Today, we're breaking down everything you need to know about serum ferritin, what it is, why it matters, and how it affects your health, in a way that's simple and easy to understand.
Hi everyone, welcome back to the channel. If you're new here, we cover health topics and medical concepts in plain language so you can take charge of your health without getting lost in complicated jargon. And today's topic is one that shows up on a lot of routine blood tests, serum ferritin. By the end of this video, you'll know what serum ferritin actually is, why doctors check it, what high or low levels might mean, and some practical steps you can take if your levels are out of range.
Let's start simple. Ferritin is a protein inside your body that stores iron. Think of it like a storage container or a vault. Instead of having iron floating around in your blood in excess, your body keeps it packed away safely in ferritin. When your doctor orders a serum ferritin test, they're measuring how much ferritin is present in your blood, which indirectly tells them how much iron your body has stored. Now, here's the key point. Ferritin isn't iron itself. It's more like the bank account that holds your iron. If ferritin is too low, it means your iron bank is running empty. If ferritin is too high, it might mean there's too much iron stored or that something else is going on in your body.
So why should you care about ferritin? Well, iron plays a critical role in your health. It helps your red blood cells carry oxygen throughout your body. Without enough iron, you can feel tired, weak, short of breath, and even dizzy. On the other hand, too much iron can actually damage your organs, like your liver or heart. That's why ferritin is such a valuable marker. It gives doctors a snapshot of your iron status and can help identify issues like iron deficiency anemia or iron overload conditions, such as hemochromatosis. Now let's talk about what's considered normal. Ferritin levels can vary depending on age, sex, and even the lab doing the test. But here's some general reference ranges. For adult women, about 12 to 150 nanograms per milliliter, ng per milliliter. For adult men, about 20 to 300 ng per ml. For children, the range is usually 7 to 140 ng per ml. Keep in mind, these numbers can vary slightly depending on the lab. But if your results fall outside these ranges, it's worth a closer look. Remember, context matters. One single ferritin result doesn't tell the whole story. Doctors also consider other blood tests, your symptoms, and your medical history. So what happens if your ferritin is low? The most common reason is iron deficiency. This could be from not eating enough iron-rich foods, having menstrual bleeding, pregnancy, or conditions that affect absorption, like celiac disease or chronic stomach issues. Symptoms of low ferritin can include fatigue, pale skin, brittle nails, hair loss, restless legs at night, and even difficulty concentrating. If your ferritin is low, your doctor may recommend iron supplements or dietary changes, like eating more red meat, beans, spinach, or fortified cereals. But here's something important. Don't just start taking iron without guidance. Too much iron can cause its own problems.
On the other side, what if your ferritin is high? High ferritin doesn't always mean you have too much iron. Ferritin can also go up when there's inflammation, liver disease, infections, or even certain cancers. However, high ferritin can be a sign of hemochromatosis, which is a genetic condition where the body stores too much iron. Over time, this excess iron can damage the liver, pancreas, and heart. Other possible causes include alcohol overuse, obesity, chronic illnesses, or frequent blood transfusions. That's why it's so important to interpret ferritin levels in context, and often alongside other tests like serum iron, transferrin saturation, or total iron binding capacity.
So let's tie this all together. When doctors order a ferritin test, they're usually looking for clues. Is this patient anemic? Do they have enough iron stores? Are they dealing with chronic inflammation? Or could there be an iron overload problem? The test itself is simple. It's just a standard blood draw. Results usually come back in a day or two. From there, your doctor will decide whether more tests are needed or whether treatment should begin.
If you've had abnormal ferritin results, don't panic. Here are a few practical steps you can take. Follow up with your doctor. Don't ignore abnormal results. Look at your diet. Iron-rich foods can help if your levels are low, but avoid unnecessary supplements unless prescribed. Limit alcohol because it can raise ferritin and harm the liver. Stay informed. Ask your doctor whether further tests are needed to confirm what's going on. The key is not to self-diagnose based on one lab value. Ferritin is just one piece of the puzzle.
So to recap, serum ferritin is basically your body's iron storage marker. Low levels often point to iron deficiency, while high levels can mean iron overload or inflammation. It's an important test that gives doctors insight into your overall health, but it should always be interpreted in context. If you learned something new today, make sure to like this video and subscribe for more clear, science-backed health content. And if you have any questions about your ferritin levels or iron in general, drop a comment below. We're here to help. Thanks for watching, and I'll see you in the next video.